If your hamstrings always feel tight no matter how much you stretch or you try to address them, it may not be a flexibility problem. You may actually be pulling at the wrong part of the holding pattern in your body, and learning how to work with it makes all the difference. So in this video, I'm going to show you why your inner thigh and hamstring tightness often isn't just about the muscles themselves. It's what your body has actually been in the habit of protecting. And then we'll walk through a simple reset that you can use to start changing that pattern if you do it consistently without ever forcing it. Hi, I'm Dr. Melanie Carlone. I'm a physical therapist, somatic practitioner, and someone who's deeply interested in how the body organizes around stress, safety, and movement, especially after injury, and getting back to your full vibrancy. So welcome back. So today we're talking about something I hear all the time. It doesn't matter what I do, my hamstrings are always tight. And that's usually followed by, I'm always stretching them, I try everything, but nothing changes it. So let's take a different lens. What if the hamstrings aren't actually the problem, but part of a larger strategy your body's using to try to protect yourself? Because when something feels tight, we assume it needs to be stretched, like that's the default. But tightness doesn't always mean a muscle is short. Sometimes it means the body's creating that tension for stability. And your hamstrings and your inner thighs play a really big role in supporting the pelvis and stabilizing your hips, and then trying to help you feel grounded. So if your system has instability somewhere else, often these muscles, they're kind of close to the core. They'll step in and they'll tighten up to hold you together, which means the question then isn't just how do I stretch them? It's what might they be trying to stabilize for me? So your hamstrings connect directly to the pelvis. So if you're sitting often with your pelvis tucked under or held rigid or lacks support in the pelvis, the hamstrings are always engaging to try to compensate for that. And this can really happen with long hours of sitting, slouched, chronic stress, or even subtle emotional holding patterns that has that red light reflex in the front of the body tighten. Because that midline strategy is trying to stabilize you, trying to hold yourself together. So if the pelvis is always being held in a certain position, what might happen if you try to stretch the hamstrings but you don't change that pattern? That's right, it doesn't work. You can stretch your hamstrings all day long, touch your toes, hold it, breathe into it, and you may feel better temporarily. But if the pelvis is still tucking under, that sense of instability or anxiety is there, if your system's feeling unstable, your body's going to return to that same tension pattern over and again. Because the goal for the body isn't flexibility. It's stability and your safety. Remember, it's always ever trying to help. So instead of asking, how do I stretch it? What if you ask, how do I give my body a better sense of support and let it know I'm paying attention? So before we go further, just notice, whether you're sitting or standing, is your pelvis tucked under? Are you gripping your legs, your buttocks, your anus, holding yourself into place? Just noticing is already part of the shift. And if that's something you're dealing with, drop a comment, let me know. I'd love to know where you feel it most, what you're noticing. And that's a simple thing that we can do to connect. And then let's try a reset. So first I want you to assess. You could do this seated or standing. I'm going to do it sitting right here on the floor. If you're seated, extend both your legs and gently hinge forward at the hips. And just notice how tight are the backs of your legs. Don't force it. Just notice how far do you go before the tension hits. And if you're standing, just hinge forward at the hips until you feel that pull at the back of the legs. And notice how far down you go. Because after we do this, I think you'll be amazed at how open the body becomes when you just pay attention and you're kind. Your body responds to gentle inputs so well. Most of us do. So imagine your pelvis like a clock right now. 12 is in the front and 6 is behind. And just gently rock 12 to 6 and allow breath to come. It happens naturally. Small movement. Come forward, breathe in, explore, breathe out, 6 o'clock, exhale. And notice as you go, the tensing and the releasing of the inner thighs. And then come back to the middle and now do 9 to 3, left to right, real slow. Let the movement be small and introduce lateral motion into the system. When the system feels more balanced, side to side, front and back, it's like the inner thighs know that you're paying attention, okay? So I'm gonna ask you, I'm gonna pause for a minute. I'm gonna ask you to do it again, 12 o'clock to 6, inhale, exhale. And then make the motion even smaller, just gently. Run to the front of the sit bones and the back. And then come to the side, left to right. And notice, usually one sit bone will go down easy and one will be harder. Often for you, you're crossing one leg habitually over the other. So bring awareness into the pelvis, right? And now come back to the center and go forward to 12 and then around to 3 and back to 6. So you go just into the right side of the body, like you were putting weight around the edge of the clock that's sitting underneath you. Inhaling forward, exhaling back. And then coming back to 12, go around to 9 and down to 6. And if you're sitting cross-legged, try switching your legs. And that will make a difference in how the pelvis is. And just go slow and notice. Just your awareness brings a nervous system regulation into the movement. It's really powerful, okay? So you've gone around the clock now several times. Now I want you to breathe in the low back ribs. Breathing in and sort of feel your back stretch as you fill. Let the back body widen out to the sides. Exhale slowly, pulling your belly button to your spine. And inhale, arch the back, widen to the sides. And exhale slowly. All of this softens front body bracing and lets your pelvis settle in with the breath. And if the whole diaphragm is expanding, what happens to tension in the legs? So let's check it out. Slowly extend one leg forward and just bend forward to the point where you feel, it's easy, but you can feel the pulling in the back of the leg. So come to that point, arch your back as you breathe in, and then pull your belly button and push your heel away from you and round. Inhale, pull with your heel, arch your back, tighten the hamstring, and then exhale, push out. Okay, so you're letting your pelvis and your hamstring work together with the breath. And just pause, feel the leg. And now switch. Do the same thing on the other side several times. Inhale, arch the back, push your hamstring down, and exhale, round the back, push your hamstring away. And just notice. Notice the hamstrings as you breathe and you allow. Right? Now, bring both of the legs forward, or if you're standing, bend forward, and notice what happens. Wow! The hamstrings let go, and all of a sudden you can move in a way that you weren't able to before. Small shifts. Because your nervous system changes with your attention and your patterning. You didn't force the hamstrings to lengthen. You gave them agency to give you information. You gave the pelvis movement. You added side to side and rounding. And then you brought the breath in. And then one small leg motion and the other one telling the nervous system, you don't have to hold so tightly. I'm here. I'm paying attention. And guess what? When your primitive brain believes that, the tension in the reflex arc of the nervous system starts to let go. So if tightness is about protection, what about long-term change because you are working with your body? Your body lets go when it feels supported, not when you're forcing it. So that means if you bring better movement through the pelvis, more balance and weight, and your breath includes not just the front, but the sides and back, those inputs over time reduce the need for the central body to hold stability. And flexibility becomes the natural result. It's not the goal. It's what happens because you're paying attention. So if your hamstrings and inner thighs always feel tight, it doesn't mean you're doing something wrong. It means that your conversation with your body can really shift. Your body's working hard to stabilize something deeper. And when you give the system the awareness, the attention, and better support, it doesn't have to grip it as much. That gamma loop, that reflex arch starts to let go. So, notice how you feel. Did something shift in your legs or your hips, in your breath? If this gentle approach resonates, make sure that you like, subscribe, give me some comments, and come back to this, because I pay attention to what you all say. And until then, keep moving with kindness with yourself, keep breathing with awareness, and trust that your body's always trying to support you. Learn to soften before you strive. It'll help you in so many areas of life. See you guys later. And thank you for working with me. It's a joy.